My patient's full report set releases tomorrow afternoon, so today I'm doing the part nobody films, getting it ready to actually be understood. A report review session sounds like the simplest appointment of the trip. In practice, it's where most international patients realize how much they didn't follow earlier in the week. I start by listing which departments still have results outstanding and which ones released digitally. Imaging, laboratory, and specialist notes rarely arrive on the same schedule, and assuming they do is how people end up sitting in a consultation room with 2/3 of the picture. Then I prepare the translation. I don't translate live from a cold read if I can avoid it. I go through the terminology beforehand, so that during the session I'm explaining rather than decoding. Reference ranges are the part patients ask about most, because the units and thresholds often differ from what they're used to at home. Before we leave the department, I confirm exactly which documents exist as paper originals and which will only ever be digital. Some patients need stamped originals for insurance or for a doctor at home, and discovering that after the department closes means a second trip across the city. Here's the small thing I always recheck: whether the patient's name on every report matches their passport spelling, character for character. One transposed letter on one document and an insurance submission gets rejected months later, long after anyone can fix it here. I also keep the follow-up questions written down as we go, rather than trusting anyone to remember them. People are tired by that point in the week, and the questions they most want answered are usually the ones they forget to ask. A report is only useful if the person holding it knows what it says and what to do next.